Um, Thank you for joining us, and allow me to thank also Dr. Hazar Haider, who has joined us again this week. Unfortunately, last week we had some technical issues and we had to reschedule. So thank you for your patience and for your also cooperation and dedication to give this talk. And we are very pleased and honored to have you with us. So just to introduce Dr. Haider, she's an assistant professor at the ethics program at the Université de Québec, Rimouski, Canada. She complete. Sorry if I mispronounced it. It's the first time. Um, please correct me. um, She completed a bachelor's degree in biology and then a master's degree in genomics and health at the Lebanese University in Beirut before pursuing her PhD in biomedical ethics at the Université de Montréal, where her research focused on the ethics of prenatal testing with a comparative approach between Lebanon and Quebec. She then completed a postdoctoral fellowship jointly at the Institute for Health and Social Policy at McGill University and the Centre de Recherche en Éthique de l'Université de Montréal. During her postdoc fellowship, she explored disability issues related to non-invasive prenatal testing, and she's currently a member of the Disability Working Group at McGill University. She's a member and researcher of the International Observatory on the Societal Impacts of Artificial Intelligence and Digital Technology, and the section editor for the Canadian Journal of Bioethics. Her research interests focus on reproductive ethics, ethics of artificial intelligence, research ethics, comparative cultural approaches, and empirical research. So thank you, Dr. Haider. Without further ado, please, you can have the floor.
Thank you, Diana and Tala, for having me today here with you. And sorry for the inconvenience last time. So, Tala, thank you again for taking care of the slides. We can share the screen. And so, hello, everyone. I'm very happy to be with you today. It's always a pleasure to be back to the roots, to my country, Lebanon. So when I was invited to give this talk, I hesitated when choosing the topic. So I was either going to speak about ethical implication of artificial intelligence in healthcare or this specific topic on NIPT or non-invasive prenatal testing. The reason why I chose it specifically is because I want to share with you some findings related to the Lebanese context. So, first of all, what are prenatal tests? Thank you, Tao, for moving. So, what are prenatal tests? Maybe some of you will know some of these prenatal tests. I will cite some like ultrasound. When a couple goes to a clinic, the pregnant woman wants to see the fetus through a window. The ultrasound is a prenatal test, although maybe the couple or pregnant woman might consider it as some tool or technique through which she can see her baby. So prenatal tests are performed during pregnancy because they give pregnant women and couples more information about the baby's health. So they help detect any problems that could affect the child to be born, like birth defects or genetic conditions. And there are two types of prenatal tests. Next, Tala, please. Screening and diagnostic. The main difference between both is that screening tests can't make a definitive diagnosis. So, if results indicate an increase for a genetic disorder, the healthcare professional will discuss the available options for a diagnostic test to confirm the diagnosis. So, as I said, prenatal tests, there are many prenatal tests like fetal ultrasound, maternal serum screening, uh, next slide please, and amniocentesis, and CVS. So these tests happens or take place in different of point during the pregnancy. Next, please. So these are some of the prenatal tests, and next, Stella, please. They happen in different time point of the pregnancy. Now I'm going to talk next, Stella, about a new prenatal test that entered the market in 2011, and it's known as non-invasive prenatal testing. So NIPT is based on the analysis of cell-free fetal DNA in the maternal plasma in order to screen for genetic conditions in the fetus. It provides important clinical benefits, especially when comparing it to conventional screening and amniocentesis. It's non-invasive, therefore performed through a blood test. It carries no risk of miscarriage, and it can be performed very early in the pregnancy, I would say as early as 9 weeks, and has better detection rates for trisomies 21, 18, 13 when compared to current screening tests. When I say high specificity and sensitivity, it means that it can detect the, for instance, the trisomy 21 with a specificity and sensitivity of 97.8% when compared to maternal serum screening test. However, we should note that NIPT or any positive result with NIPT should be confirmed by a diagnostic procedure that is either amniocentesis or chorionic villus sampling. So up until now, this test is considered to be a screening test. Next data, please. So NIPT is used primarily to screen for trisomies 21, 13, 18. It can detect the sex of the fetus, and it's used to screen for sex chromosome aneuploidies and some monogenic diseases. But in the future,
Dr. Haider,
yes,
sorry to interrupt you. But someone was telling us there seems to be a problem with the slides. If we can just pause for a moment, and if Tala, can you maybe stop sharing and reshare again, just to make sure that. Sorry to interrupt, but
no
apparently they weren't showing. Okay, I think now it's.
It now?
Yeah.
it's
Now,
working.
can you switch between them? Okay, yeah, they're moving now. Yeah, so
Okay.
thank you. Sorry,
No
you
problem.
can proceed.
Yeah. So the next slide, please, Sutala. In the future, NIPT might test for a growing number of conditions and potentially have the capacity to sequence the entire genome of the fetus, which has been demonstrated by proof of principle study. So, sequencing a completed genome will reveal much more than just diagnosis of severe conditions. For instance, it will also produce what we say clinically of variants of unknown significance, genetic variation whose association with disease risk is unknown, and non-medical genetic markers that have no health-related genetic significance, such as, let's say, eye color, intelligence, hair color, and others. So what do parents do with the information they get from these tests or NIPT specifically? Some will choose to terminate the pregnancy if it shows that the fetus has, let's say, a genetic condition or malformation, some will use the information to better prepare themselves for the birth of a child with a certain disability, and others will choose to put their child up for adoption. Next, please. And next. So what about the introduction of NIPT in Lebanon? NIPT in Lebanon was introduced at the beginning of 2013 by a company known by Prenatal under the name of Verified Test. As I know of, it's available also under the under Panorama Test in Lebanon. So samples are sent to the US labs for analysis, and the price in Lebanon varies between $600 and $1,200 US depending on the abnormalities to be detected. Next, please. A study performed in 2013 showed that there was an increase in NIPT used to detect trisomies, and the evidence provided by this study was in support of the acceptability of NIPT in Lebanese unique cultural setup, and it may serve as the basis to encourage the implementation of the test as a safe and acceptable option to patients in Lebanon. So this study served as a starting point to my research. Next, please. And therefore, following, of course, all the ethical approval requirement, I conducted semi-structured interviews with pregnant women, their partners, and healthcare professionals. Healthcare professionals are OBGYN and nurses in Lebanon, in addition to genetic counselors and medical geneticists in Kenya. So the analysis of my data showed different themes that emerged, next please, and that were common to both groups, pregnant women and healthcare professional, with a specific theme that emerged during my interviews with healthcare professionals, that is the barriers for an appropriate ethical implementation of NIPT. Next please, Tala. So I'd like to note that a more in-depth exploration of all the previously mentioned themes can be found in the published study findings. You can search for these studies online. And just for the sake of time, I'm going only... Sorry? So for the sake of time, I'm going to only discuss factors that influence pregnant women and NIPT decision-making to accept or refuse NIPT, and the barrier, according to healthcare professionals, that might be considered for an ethical implementation of the test. Next, please, Tala. So these are both teams that I'll be speaking about. Next, please. So next, so we identified 4 factors that influence NIPT decision-making, couples' decision-making regarding whether they would accept or decline NIPT. These are the features, next please, Tala, features of NIPT, abortion and pregnancy management, influence of others, including partner and healthcare professional, and the cost of NIPT. Next, please. So the clinical benefits of NIPT, its non-invasiveness, earlier detection, high accuracy were important factors for pregnant women considering NIPT. As stated by one of the participants, I thought that it was a great alternative for the amniocentesis, and it's better. It's not a needle that goes into your tummy, and it's just a blood test. So for me, it's safer. It sounded safer for the baby. Another factor that seemed to influence their decision-making to decline or accept NIPT was participants' attitude toward pregnancy management. When I say pregnancy management, it's either terminating a pregnancy with that has shown that the baby has genetic condition, or to prepare for the child birth, a child with certain disability. So the majority of Lebanese participants stated that they'd like to prepare for the child. So as one of participants puts it, at all cases, even if I did the NIPT, God forbid the baby had any abnormality, I'll prepare myself throughout the pregnancy. I'm against abortion. It's against religion. I will accept whatever God gives me. Next, please. Also, another important element is the impact that the others, when I say others, I mean the partner and healthcare professional, had on the decision making whether to accept or refuse an IPT. So when an IPT was perceived to be necessary or recommended by their healthcare professional, several participants stated that they would go with the recommendation of their physician. If the doctor says that medically he believes that the test should be done, it should be done like any other test. And definitely there is no reason to decline it. So I asked also pregnant women and their partners about the influence that potential disagreement about accepting or refusing the test would have on the pregnant woman's decision to accept or decline the test. The majority of Lebanese partners were inclined to have a discussion with their female partner in order to reach a certain consensus about the decision. But few women said that at the end they would follow their own opinion because it's their own choice. It's them who will be the most anxious during the pregnancy. As one woman states it, no, it will not influence my decision to consider the test because I'm the one who will be the most stressed out and anxious about the baby's health, even more than his dad. And I think he'll understand my decision. Finally, one of the four factors is the cost of NIPT. Although the cost was high, and even though today is very, very much higher, so I think few, or I don't know the number, but with everything happening with the economic crisis, it will not be accessible to a lot of pregnant women. Few Lebanese participants mentioned the cost of an IPT when I was doing my interviews as factors that will influence their decision to accept or refuse the test. Also, they said that yes, it will be inaccessible for individuals of average and low income. Several stated that if they were labeled as high risk, the cost per year would be less important to them. So if a person has a high risk, I don't think any mom or any parent, if put in place where they have to pay money for the sake of their kids, they would say no. Probably if I knew I have a high risk and I needed to take the test, then of course I'll be paying for it. Regarding the following themes, barriers for an appropriate ethical implementation of an IPT, according to healthcare professionals in Lebanon, they were 5 emerging themes or barriers to the test implementation. And these are the economic, the societal, organizational, the Lebanese abortion policy, and the healthcare professional financial gain. Next, please, Tala. And next slide. So, according to healthcare professionals, they cited the cost of an IPT as an important limitation for the test ethical implementation. They argued that the introduction of an IPT will exacerbate the existing lack of coverage for prenatal screening tests in place. As one of the healthcare professional puts it, there is, let's say, the monetary problem, so the money covering the test. I mean, there is nothing really covered by insurance. So how about a test that is 5 times more expensive than regular screening tests is gonna be covered by insurance? That's like a huge limitation. On another societal level, Lebanese healthcare professionals were less concerned about termination of pregnancies when the pregnancy is found to be high risk or the child is affected. But they stated that the potential misuse of the test for sex selection is of concern for them. So, as a healthcare professional puts it, my concern with this test, if it's widely available, is really sex selection. So, if we have to use the test at 9 weeks to determine sex selection, and we, society may suffer if we end up doing terminations for the wrong gender. So, this is a misuse of the test. I think it's on exactly the geographic location in Lebanon, but I can honestly see both ways. It could be used for someone who's had 3 girls and they are looking for the boy, or vice versa, for someone 3 boys and looking for the girl. On an organizational levels, a healthcare professional showed concerns regarding the knowledge of other healthcare professionals about the scientific properties of the test, including its sensitivity, specificity, the fact that it's still a screening test, not a diagnostic procedure. So, non-optimal counseling. So this test is very new, and not every provider is aware of the power of this test, its positives, negatives, and what's the specificity. There are doctors who do not know about it. A big portion of doctors still don't know about the test. Finally, Lebanese abortion policy was only brought up by only 2 healthcare professionals. This could be explained by the fact that abortion is performed in a very clandestine manner, so it's there on the black market, and thus participants didn't consider it to be a barrier. Another explanation could be that maybe healthcare professionals avoided an explicit discussion of the clinical practice of termination of pregnancy for fear of being prosecuted by justice for infringing the law, as stated by the following quote. By law in Lebanon, there is no termination of pregnancy. It's done, but by law, it's not allowed. So we cannot say it's clinically done because we will go to jail. One day the law will change, but again, the culture is not going to change. And there is a huge chunk of the population that want to do nothing about this, even if it's abnormal. The final themes within the barriers for the ethical implementation of an IPT is considering the significant influence of pharmaceutical companies and their marketing strategies on physicians' behavior to prescribe drugs, such a situation might be compared to an IPT, which is being currently also marketed directly to the physician. Therefore, healthcare professionals feared that there might be a potential surge in NIPT prescriptions because some healthcare professionals, in her opinion, might see financial profit from it. I fear that because of the marketing and the companies who are in competition to sell their products, NIPT becomes a business through which the doctors prescribe more and more of the NIPT tests. So they make a financial profit. So also for the sake of time, I'm not going to discuss all the themes, but I chose only the abortion theme specifically because we know that prenatal testing, when discussing the prenatal test, we have to link it to abortion or termination of pregnancy that is influenced by the culture, the policies in place. So we know that under the Lebanese penal code, abortion is prohibited at any point in time except to save the mother's life. So clinical level, however, it's offered for patients with fetal indications such as trisomy 18, 13, 21. Of course, it's practiced in a clandestine manner on the black market, and the price varies between $400 and $5,000, depending on whether the abortion is taking place on a clinic, depending on the physician that is doing the surgery. So the introduction of an IPT into the Lebanese healthcare system doesn't influence next therapies, the choice of pregnant women or couples insofar as it expands their testing options without really changing their choices regarding how they want to manage their pregnancy. One question that could be asked is, at the same time, is an earlier testing with an IPT starting the 9 weeks of the pregnancy a better choice for patients who will have to face an unsafe and, in fact, an illegal abortion? Another themes that was tied to abortion was, next please, Tala, the sex selection. So Lebanese clinicians were concerned by the increase of pregnancy termination related to sex selection, especially for family balancing purposes, but not for affected pregnancies. Of course, this issue can be contextualized by the important weight that is placed on gender and sex rather than other diseases. We know that religious beliefs play a crucial role in patient decision making for declining the termination of pregnancy for certain fetal indication, which is confirmed in both studies with healthcare professionals and women. However, in Lebanese society and in some specific region, the cultural value placed on gender, male favoritism, as well as family balancing is of crucial importance. And these preferences are reflected in clinical practice by the presence of many clinics in Lebanon who offer IVF, in vitro fertilization, for family balancing as one among many services they provide. Finally, given all the ethical, social, and policy concerns, there is a necessity to a need, not only a necessity, to educate pregnant women, patients, and partners, and to provide them with pre-test and post-test counseling processes regarding the test, but also to inform all healthcare professionals who offer this test and keep them up to date to offer the most up-to-date information. Also, as this technology is advancing at a rapid pace, there is a need to create guidelines and recommendations to guide the use of an IPT in general, but also because it will be used in the future for more trivial or more a wider range of conditions, like I said, such as career risk, such as variants of unknown significance, a risk to have, I don't know, Alzheimer in 50 years. So we need to create these guidelines to better offer the test to patients or to pregnant women. So this was it. Thank you a lot, and sorry for any inconvenience from my part. And questions and the suggestions are, of course, welcome.
Thank you so much, Dr. Haider, for this very thorough and informative presentation. I wish we had more time to delve more into the details of it. So if anyone would like to pose any questions, please feel free to unmute yourself or ask the question in the chat. Now I will start with a question of my own, actually. You mentioned in the end the importance of guidelines and developing guidelines. I mean, well, considering that you did this on our context, how does this perhaps, in a way, how would this compare to other countries? And especially in the region now, we have, I mean, there's a lot of development in the medical field in the region. So has this been addressed in other countries, and perhaps in what way might Lebanon compare? And how, I mean, of course, contextual considerations are specific, but there are commonalities that perhaps would be important.
Yeah, of course. Thank you, Diana, for this question. So to start with, when I did this comparative empirical research, there were no, also like in Quebec, there was no local guidelines for the use of an IPT. There were more I would say, the professional guidelines by the American, let's say, Committee of Obstetrics and Gynecology and others. And because the technology was advancing, I would say for instance, in Canada, it's very recently that we had a guideline on how to use the NIPT because at the very beginning, the test was called NIPD diagnosis, non-invasive prenatal diagnosis. But when there was the clinical, there was wider clinical research on it, we moved to the specific term of NIPT to say that this test should be used as a screening and not diagnostic. So the guidelines development is still ongoing, I would say, because the use of the technology is still developing. In Lebanon, I think there is no current guidelines for the use of an IPT. And of course, healthcare professional would refer to what more international guidelines would say about the use of this test. Yeah, so this is the big picture of about the guidelines and recommendation. Maybe at the short term, there will not be a development of a guideline, but of course, to refer to international guidelines is a good move to healthcare practitioners, so they are able to offer the test in a way that is scientifically and ethically appropriate.
Okay, thank you for your answer. Let's see if okay, doesn't seem there's any questions in the chat. Now, what about the social aspect and the culture, which you also mentioned, particularly with the perhaps the motivations to use this test with regards to you mentioned family balancing and gender selection. Could this also be, I mean, the culture is pretty much stable, but there are maybe the current economic situation, especially, might have a big impact on that as well. So that might change perhaps the choices that the people make. And how can this be? I mean, if we want to educate the public about these options, how can we cater for the Lebanese population in that way?
Very interesting question. In fact, when I asked my participants about what they think about sex selection using the test, I would say the majority were against using it for sex selection. But still, because it's happening. Even if in the literature we can see that there is no reporting of such practice, we can still hear about it. There are a lot of stories and anecdotal evidence about the use or sex selection in general using another technology. So yes, it's one of the concerns of healthcare professionals, but I would say that now with the economic crisis and the cost, the prohibitive cost of the test, I would say less people would be maybe would go for this option just for family balancing. Of course, there are people who can still access and can still afford to pay for the test for this particular use. There are unfortunately no guidelines in Lebanon also on whether to use this test or not to select for the baby sex. Also, I would say, for instance, in Canada, there are no guidelines regarding the use of the test because there are you can go and test and have an abortion for any reason. There is a legal void about abortion, but in Lebanon we know that the legal abortion the abortion policy is there. It's not enforced, so it will keep the door open to those who will want to use the test to have to select the gender of the fetus. How we can educate the population in this regard? Maybe it's the role of especially the healthcare providers who would be counseling pregnant women or the couples to, I don't know, inform them more about the use of the test, about why maybe it's not a good idea to abort for the wrong gender, and yeah, providing pre-test and post-test counseling. I would say pre-test counseling, especially.
Thank you very much. Is there anybody else who would like to ask a question? I think we have. Yes, we have one in the chat, I believe.
Anything that
From Dr. Nabil Sharara, he's asking, don't you think that this will lead to more genetic selection in the future? So perhaps not just not with regards to gender, but other other aspects.
Well, of course, this is the main concern of using NIPT to select for future condition. Let's say that the NIPT will detect the risk of the child to be born to have Alzheimer in 50 years. It will say, okay, you have a 50% to have Alzheimer. So parents will decide to have a termination based on a risk. And this will lead, of course, to what we call eugenic society, a society where, like in the movie, of that's called Garaka, where people have the best genetic makeup. So definitely, this is a concern for using NIPT for genetic selection. And I will give an example because I'm also doing the research on this, particularly within the Canadian context. We're still discussing as if NIPT use should be banned or prohibited for some genetic conditions, which might be very difficult to decide because we know that the reproductive choice here and the liberal choice of parents is of utmost importance. And if we want to offer an IPT for a wider range of genetic conditions. Would it be covered by the healthcare system in Canada or not covered? And of course, if we want to tell the parents, okay, this is an IPT, these are the range of conditions that can be detected through it, like, would you be able to choose any of them? But of course, there are clinical limitations because we will see some genetic some variants of unknown significance, and where healthcare professional can't even interpret these findings. So definitely it will lead for more genetic selection. And that's one of the big concerns of this test. So we'll end with the survival of the fittest. I wonder if it's, yes, it would be a technical connotation, the survival of the fittest, or what we more call here, like label as the eugenic selection.
So, unfortunately, I guess the internet was poor for some of the attendees. We can, it is being recorded, so we will be sharing the recording afterwards. Now, I'm not sure about the presentation. It's up to Dr.
Of
Haidar.
course, Diana and Tala, I can send it to you. Maybe some of the participants would like to see it.
Yes,
That's
sure, I have it. I can
great.
email me. Yes.
Thank you, Tala. So, if there are no more questions, anyone has a comment, maybe, please feel free to ask. I mean, the last question, I feel, opened up a very important can of worms, I think, with regard to the selection and survive, or selection of the best, so to speak, future generations. Definitely a very thorny topic. It seems we don't have any more questions. Oh, yeah, thank you. Thank you as well. So I think we can wrap up the session. If anyone also would have any questions or concerns later on, please reach out, or anything you would like to communicate to Dr. Haidar, please feel free to contact us as well. We can relay that, and we will be sharing the presentation. Thank you, Dr. Haidar, so much for being with us and for your time. And we look forward to future opportunities to collaborate as well. Thank you so much.
Thank you so much, Diana, Tala, and thank you for Talia and regards to her, and thank you for all the participants.
Thank you.
Doctor.
Bye.